Heel pain can cause major discomfort and inconvenience. There are several possible causes of heel pain, and it is important that it's properly diagnosed. Dr. Nalaska Soliotis talked to us about the different possible causes of heel pain and how to treat them.
Heel pain can occur on either the back, bottom, or sometimes even both of the heel. Causes ranges from Haglund's deformity, which is the abnormal structure of the heel bone, Achilles tendonitis, bursitis, plantar fasciitis, and sometimes even stress fractures. Plantar fasciitis is one of the most common causes of heel pain. It is basically an inflammation of the plantar fascia that extends from the heel bone to the ball of your foot. The inflammation usually occurs on the bottom of the heel, but it can also manifest in the area of the arch as well. The most common cause of plantar fasciitis is usually a faulty structure, which could be high arch or a low arch. Wearing non-supportive footwear is a contributing factor, as well as sometimes increase in weight gain or age as well. We also see it on people that have jobs that require long hours on their feet. Symptoms of plantar fasciitis are pain on the bottom of the heel. Pain is usually worse upon rising, so in the mornings, first couple of steps are pretty painful. Then once you start walking, the pain gets much improved. Also, there's something called post-static dyskinesia, which is basically when you've been sitting for a long period of time and you stand up, those first couple of steps are very painful, but then once you start walking, it improves. Treatment for plantar fasciitis, first line of treatment is basically stretching, icing, and support. Stretching is very important for this, and I really spend the time to educate the patients on the stretching part of this. Most patients, when they stretch, they do about 3 to 4 seconds. So I usually recommend doing 30 to 40 seconds each time you stretch, so then you get enough time for the brain to get the signal that you're actually stretching. Support is very important. Support in itself is a separate conversation, but basically anything to increase the support in your shoes. There's inserts, there's off-the-shelf inserts that you can use, and also custom inserts, which are called orthotics, and usually you get those from a specialist like a podiatrist to get molded for those. Also, I start patients on anti-inflammatories if their pain is actually very high. I start them usually on a steroid treatment, which could be oral or an injection directly to the area of the plantar fascia where it inserts to the heel bone. Other things like physical therapy, I do believe that we can treat this without having to immobilize, but sometimes when you're not responding to these forms of treatment, then immobilization becomes an option, and that would be basically putting you in a boot for about 3 to 4 weeks. At this point, I'm starting to get an MRI, because if you're not responding to non-surgical options, then we start thinking of surgical planning as well. The good thing about this is that most patients do respond to non-surgical treatment. About 90% of patients do respond. Therefore, very few require surgery. And surgery is there's non-invasive options for surgery. Basically, releasing the plantar fascia from the heel bone, and I sometimes add as well a gastroc release, because all the posterior muscle groups are tight, and that would be the surgery.
Dr. Soliotis has the knowledge and expertise to address and solve whatever issue you're facing with your feet. Don't let foot pain keep you from doing the things you love.